that tray is not available.
All right, welcome to Pigtails 101. My name is Dr. P, and we'll talk about pigtail catheters. Pigtail catheters are small in diameter. They're 14 French, specifically this one that we have, and usually that's how big pigtail catheters are. So these 14 French catheters should only be used in instances where you have a pneumothorax or you have a pleural effusion. They shouldn't be used in trauma patients who have a hemothorax, because the blood, once it gets into the small lumen of the catheter, it clogs up and then it's not, functioning. So for trauma patients, always you should go to a chest tube, a big bore chest tube, at least a 28 French. But if it's just for especially spontaneous pneumothorax, or a trauma patient who doesn't have on X-ray an effusion, which is most likely a hemothorax in a trauma patient, but if it's just a pneumothorax, then these can be used. And again, these are 14 French pigtail catheters. There's a few different kits out there, but I think this kit, after review, is the best because it has most of the things that we need in it. So we'll try to stock these, which is called the Wayne Pneumothorax tray. So once you open it up, it looks like this. So what the nurses will need for preparation for a pigtail catheter is one of these trays. It would be nice to have what is it?
Chloroform?
Oh, no, that's in here too. The surgical
Drape?
drapes.
Okay.
For
Those are in here.
So it's down and
Towels, yes, towels.
Lap
Surgical,
sponges.
correct, surgical
Yeah.
towels should be fine. Anyhow, so what the doc will do is prep the area, and usually the area we usually go for is just across, right near the nipple line, or just underneath it. But what I do before I put it in is I would always check the chest X-ray to see where the level of the diaphragm is, and then compare it to the axilla as well as the nipple line to see if I'm going too low, because some people have like eventration or something like that and their diaphragm is way up, and when you poke it in, sometimes you're in the belly. So I always check and try to keep a safe margin. So usually that's about the nipple line or maybe a rib space underneath. So you prep the area and you have the patient, put their arm up and drape. And then the first thing that we're going to do is you take the needle with the syringe and you numb up the area, and then with the needle, what I do is I feel for the rib, because the neurovascular bundle always runs underneath the rib. So when I go in with the needle, I try to stay right above the rib rather than going underneath the rib. And then what happens is the intercostal vessels can get disrupted, and then you can have a massive hemothorax. So I always poke with the needle. Sometimes it hurts a little bit when you're poking something sharp on the rib, so I numb it up pretty well. Then poke, and then suddenly you feel that release because you're right above the rib. And then while I'm aspirating, I go in, and with the pneumothorax, you're going to feel a gush of air coming out. And then I take off the syringe, leave the needle in, and then I put the guide wire in, which is also in the kit. I put the guide wire in. People have asked how much of the guide wire do I put in. You need it at least to be inside the chest cavity, so it only has to go in longer than the needle itself. But the wire is very flimsy. It won't do any harm inside the chest cavity, so I try to put it in as much as I can at first, so that it's not dislodged when I do stuff. So I put the guide wire in, and then I take the needle out. So you're going to have this wire that's poking out the patient's chest like this. You take the knife and make a skin incision just right next to the wire. And that's also very important because you're going to have to dilate and put a 14 French chest tube in. And the skin is where you have most of the resistance. So you have to make a decent sized cut in the skin. And then the doc will dilate, and there is a dilator in this kit. We'll dilate over the wire and then afterwards put the pigtail catheter in. And it's pretty intuitive. The reason why it's called a pigtail catheter is it curls up like a pigtail. Now, there's a few other kits. This one, this specific kit doesn't have a wire inside the pigtail. And what the wire does is normally the catheter is straight, but the wire is connected to the inside and connected to the tip. So when you pull the wire, it curls up like this. So later on, those chest tubes, when you take it out, you have to cut the wire and then pull it and then pull the wire out as well. But anyway, this specific kit doesn't have that. It just automatically curls up by itself. So once you dilate, you still have this wire poking out. And over the wire, I put this in and then into the chest cavity. Now, this has holes all the way up to here, and it has little black marks, so all you need it in is to where the black marks are. Once that's done, you take out the wire, and then you take out the inner dilator as well, and then this will be left inside the chest like this. Afterwards, connect it to the pleural vac. Before you do that, this part is not compatible with the pleural vac directly, so you need this adapter, which is also inside the kit. That's why I like this kit. If you use any other kit, you have to separately open it. So this one just connects like this, and then this part you can connect to the pleural vac. So once the pleural vac is open, before what we do is this is a 3-chamber pleural vac, and the way it works, it's complicated. You have to Google it. But before, in these 3-chamber vacs, they need a water seal. They need a chamber that's filled with water. And before, we used to just insert the water here, but these pleural vacs, you can't do that. And it says so. Don't put the water in here. So take this out, and then there's a little place where you can insert the water. So we'll do that right now. Take this off, and then you just inject. And then in the front, you can see that the water is going in. And it colors, there's a little blue coloring. So it turns blue, and you know that the water is in there. And then you take this out, and then you hand this part to the person who's putting in the pigtail catheter, and it goes in just like this, and that's why we need this adapter. Afterwards, everybody asks, oh, what do I put the suction on? And again, the suction is connected to this part here. It doesn't matter. You can put it on full suction. You can connect it to a Dyson vacuum. And the reason is because this part regulates the amount of suction that actually goes in and sucks through the chest tube. And on the side, you can switch it over. See, -10. And usually we put it to -20, which is the default. And the way to know whether this is actually working or not is if you turn on the suction, and if you connect the suction here, you'll see that there's a little thingy that pops out, and that's how you know the suction is working. So if you pull it out, it goes back in. If you suck, that's how we know the suction is working. Just like that. And then obviously you need a chest X-ray.
How do you secure it?
The chest tube?
Yeah.
This chest tube, so we've put it into either one of these black markers, and then you secure it to the skin, which also this kit has a silk suture, so the surgeon or MD will suture it to the skin. And then for the dressing, I usually like a central line dressing kit because it has the little round thingy. and it has nice stickers that, it's kind of like small like a central line, so you can put like a nice central line dressing on it, and it looks nice and comfortable for the patient, rather than like big silk tapes going across the chest. So, any questions so far?
So Dr. P, I know we're gonna try to have those kits,
Yes.
but in the event that that kit is not in the drawer and you just have this pigtail to work
Okay.
with, can you
So-
just go over?
Just to go over quickly about what we used, we prep and drape, and then we need the needle and a syringe to do the first stick. This kit doesn't have that. It doesn't have a needle. What this kit has is, inside the catheter is a needle directly that goes through here. So you just stab it in, and then you take the inner needle out. And I don't like that because that can injure like structures inside. So if we're going to use this kit, and we're going to use a Seldinger technique, which is the guide wire, and over the guide wire we dilate, and over the guide wire we put the line in, then I need a central line kit. A triple-lumen kit should suffice.
It's right to the right,
Um,
right there.
because it has the needle. All we're doing is like putting in a central line, but instead of the line, we're putting in the pigtail catheter. So I think that's a very good way of putting it. You just need everything you need for a central line and the catheter.
So with these kids,
Mhm.
right, so you're gonna have your guide wire in there, you're gonna be in there with your central line kit.
Yeah.
But then, so what's the difference here? Because you said that one has
Here, let me open this.
the wire, so you just pull out the wire
So this one,
before, like, once you do your central line kit
Right.
and you,
so this one specifically has the string inside that I spoke about. When you pull it, it curls up. So this is flimsy, so you need something inside
right,
to put it in, and this one specifically has these long, scary looking things. This one is just a sharp
for this one?
needle, and it doesn't have a lumen.
Okay.
So
Where is it?
if you want to use this, then you're just putting it in, ramming it in, and then taking this needle out before you injure something. So I don't like this.
Right,
This one has a blunt needle with a
Oh,
lumen
okay.
inside,
yeah,
and what I do is, and this one doesn't have a lumen, and the reason why, I'll show you, is what I do with this one is, I straighten this out with this, sharp, like this,
yeah,
and then I take out the first inner one,
Yeah.
which doesn't have a lumen in it. Now you have something that's stiff inside that has a lumen. So with the central line kit,
Right, then
you're
you
putting
can
the
take
wire in, and then over the wire you're putting this
That,
in,
and
and
once
then,
you're ready,
yes,
you're taking the
exactly.
whole thing.
Again, we'll try to have the other kit, like the
Yeah.
easier kit. 'cause
Yeah,
I-
'cause I mean, then you're
Yeah.
wasting a whole central line.
Right,
kit
right.
Yeah.
Just
So,
for like the
exactly,
producer
yes.
needle.
Yeah.
That one doesn't have markers on it, does it?
Story of our life. Yes, correct. It doesn't have markers in it, but as long as you have all the side holes inside the chest, it's okay. And then once this goes in, this curls up. So what you do with this string is you just pull it, it stays curled, and then you clasp this so that it doesn't, open back up, and then you just cut the string. So
And
again,
then you
this
need
is
the adapter,
right,
which
correct.
is a separate
And then,
package.
Separate.
and then you need this adapter, which is not in here, so you have to open it up separately
Which is that?
here, and then connect it here, and then connect it to the chest tube. So this kit, you need a lot of other stuff, so that's why I prefer this one.
Anyone have any questions at all?
Can we have a list of stuff in case that's not
Yeah.
available?
Sure.
List with what's needed?
Yep, sure.
Listen, I mean, you do like little packets, like we used to do intubation packets.
Yeah, I mean,
Like,
ideally, I think we should just have that other tray.
Right.
No, yeah.
It'll be either
Yeah.
this tray and the Pluravac, or
Yeah.
again,
The-
this one, and then because we're just thinking of it as like a central line rather, and then putting in the pigtail catheter, you need the central line kit and
The pigtail and the extension.
correct.
And the-
Thank you so much, Dr.
All right.
P.
Yeah, Dr.
Thank you.